Hey everyone, welcome to another episode of the Coach's Corner University podcast. I am your host, Paul O'Neid, and today we are brought to you by Coach's Corner University. Use code podcast300 to save $300 on our education collective, which is over 200 hours of continuing education for $50 lifetime access with code podcast300. You can also visit TC Nutrition, use code TCXONEED for 10% off. Barefoot.store, that's BEAR, like RAR, like a bear, for when you use code ONEED for 10% off. And then also baconandbarbells.co, use code PONEED10 for 10% off. And today, that was actually the best ad read I've ever done. So, Joel, you're great luck. I want to reintroduce, second time on the podcast. The first episode that we filmed was one of my favorite ones, and I had to have him on again. Joel Proskewitz, thank you so much.
Paul, it's my pleasure. I must tell you, I get a lot of requests to do podcasts. I don't do all of them. And after our first one together, I thoroughly enjoyed speaking with you. It was very inspiring, not just the questions you asked me, just your insight into life. And so to now be sitting here again in a very different situation, which
Yeah.
I'm sure your listeners know, again, is actually very, very inspiring for me because I've watched your journey, and I'm fired up, man. So thank you.
Well, thank you so much for the kind words. It's like I mentioned before the call, it's been a pretty crazy journey, and I think one of the things that has been constantly been front facing throughout this for me is the difference in the way the mind affects the body. And, you know, I was very open initially with sharing my thoughts and my reflections and my mindset as I approached injury. And I wanted to have someone on the podcast who could speak to the same level as me in terms of, but as well have that clinical background as well. And I think, although my injury was to the knees and you deal primarily with the back, there are so many parallels with regards to mindset, with regards to rehab timelines, with regards to expectations and reality, and the differences between the two. And I kind of want to pick up where our conversation pre-podcast started, in that I was given these timelines of, okay, you're going to be in a wheelchair for 6 weeks, which I totally get. The bone has to heal. Awesome. Then you're going to be walking in knee braces for 6 weeks. Then you can take the knee braces off, and then you have to retrain, get back your range of motion. So you'll probably get range of motion by week 16. And then by week 20, you should be able to progress further. And I'm sitting here almost 11 weeks post surgery. I only spent 4.5 weeks in the wheelchair. I was on a walker for 3 hours instead of 3 weeks. I was in knee braces for 2 weeks instead of 6. And at no point, people might be like, "Oh, why are you expediting your timelines?" But at no point did I push the envelope. At no point did I accumulate. Like, I have had zero setbacks in terms of, "Oh, I did too much today." And this is something that I think you have a very unique perspective on, having gone through your own spine surgeries, your own multiple recoveries, and also handling the recoveries of multiple people. So I'd love some insight, like pick up where you left off talking about timelines and the individual.
Sure. Paul, I get to hear this, on a daily basis. Patients are in front of me, either they've had surgery or they're coming to me with back pain, and they're told that something miraculous is going to happen within 5 or 6 weeks. And if that doesn't happen, then they've either got to have surgery or, there's a further uh, investigation required. And I have a major problem with that because I understand why clinicians are putting a timeline on recovery. I get it. But
Mm-hmm.
I think one of the major things that they miss is taking that particular individual into consideration. We are all built differently. Some people have got extremely resilient makeup. Other people don't. They're a little bit, softer. It's not right. It's not wrong. It's just different. And I
Yeah.
think we really need to consider the individual. And I'll give an example with regards to recovery. I've had individuals come and see me after spinal fusions, which are humongous surgical procedures.
Yeah.
Right? It's a huge trauma. And their surgeons have said to them, in no uncertain terms, within 5 weeks, they'll be back running, they'll be back doing Peloton, or they'll be back in the gym doing a whole bunch of things. And these patients now get to 5 weeks and they're still highly disabled, right? Because
Mm.
the surgeon possibly was comparing them to another patient who did recover in 5 weeks, who was, I've got an example in my mind, but there was this instance where this patient recovered and in 5 weeks was doing a whole host of things after a fusion. But this patient was an Olympic athlete. Now, an Olympic
Mm.
athlete is not comparable to Joe Public. They're completely different individuals. The way that that athlete had been conditioned prior to the surgery, the way the athlete maybe is eating and their supplementation protocol. So I think it's not in the best interests to define and put a timeline in someone's mind with great expectations when in actual fact they get to that particular time and they may need a little bit more time to recover. But in your case, that was very different because they had given you just a generic set of rules, possibly,
Yeah.
but they didn't take into consideration who were you before your injury and surgeries, right? How does your mind work? Who are your support structure? Or what is your support structure? I know a little bit about your wife. She's an athlete, right? So
Right.
again, her mental thought process is going to be very, very different to someone whose partner is not. So she was there encouraging you, doing a whole host of things. As the famous saying goes, warriors of the same disease have much to talk about. So again, I think from that perspective, Paul, I think it's a very futile thing to just put a timeline on a patient and say, this is what's going to happen. I think you really need to consider who you're talking to and all of the other factors outside of just the natural healing recovery healing process,
Yeah.
and what how they view the whole thing.
One thing that I was very cognizant of from the beginning was I didn't want to push the envelope. Like for me, I had no desire. Right when I got injured, I had this like moment of clarity and acceptance, and there was never any doubt that I was going to rush the process to get back to powerlifting, or I needed to squat 800 pounds again, or anything like that. But for me, knowing that there was a balance between it, we know that it takes certain times for certain tissues to heal. For example, because I had patellar fractures, or like it's going to take about 6 weeks for that bone to heal around the screw. I was like,
Sure.
okay, cool. But does that 6 weeks factor in the fact that my nutrition was 100% dialed in? I was supplementing with collagen, with vitamin C, with K2, with Boswellia, with curcumin. I was using TB500, BPC 157, and GHK copper. I was using low dose Anavar as well, and I was also using muscle stim 3 times a day. I was doing blood flow restriction training in full knee extension. I was doing PEMF therapy for 4 hours a day, and all of these other factors to increase the rate of healing. And so I kind of took the idea of I'm going to do all these things, but still respect that initial timeline to a certain degree. And I think because I was a little bit more conservative up front, it set me up for this expedited I had that mindset of like, if I'm conservative now, I can be a little bit more aggressive later. And that paid off for me. But I think for a lot of people, especially those who are, you mentioned my wife, which is really interesting. I hadn't considered this. A large motivator for me was feeling like a burden on my wife. And that was nothing that she put on me. That was just my personal feeling. So a lot of the motivation to do these activities and participate in these behaviors to speed recovery were in an attempt to alleviate the strain on my wife. But I'm wondering, had I not had that supportive environment and that motivator there, would I have been as compliant as I was with the rehab? And it's really cool to consider this holistic look at the big picture of, yes, there's the physiology, there's also the individual's mental makeup, there's also the social environment that they are in, and then all the interactions there within. I thought that was phenomenal.
Yeah, Paul, and those are, as you and I have discussed previously, I'm not a huge social media person, but
Hmm.
when I do get on there, people know what my hashtag is, which is everything matters. I consider absolutely everything until I don't need to. So, with that in mind, you just said something now that sort of sparks a little bit of a thought process in my mind. Is you turn around and said you were conservative in the beginning to allow
Hmm.
yourself to be a little bit more intense and aggressive later on. That is exactly the problem I see, or the reverse of that is the problem I see
Okay.
with regards to spine rehab. Because
Mm.
people generally prior to surgery, they've got a lot of the majority of pain is leg pain. It's never back pain. Back pain is actually a very small component of why people would actually go for spine surgery. However, so if someone's dealing with significant neurological problems and pain down their legs, sciatic pain, they go for surgery. And let's say the surgical procedure went according to plan, the expertise of the surgeon was, outstanding. The patient wakes up and they're pain free. And that is a problem because they now think they are healed. The problem is now solved. So, what happens is they go for the next 2 or 3 weeks, everything is pain free. They then start their physical therapy routine. And now the physiotherapist wants to get them moving and get them, back to their normal lifestyle factors. And all of a sudden, 6, 7 weeks down the line, I get the phone call, right? Because they're back
Hmm.
in pain, something's gone wrong. And then you sit down, Paul, and you go through what their regimen was post surgery. And I'm like, man, oh man, that just can't be right. Okay. Because you being pain free does not mean that you have healed from a really large trauma. Because that's what, in actual fact, I'm thinking back.
That's Yeah.
Sorry,
Yeah,
I'm
sorry.
thinking.
Sorry to interrupt, man. I'm like, yes, 100% yes.
Good, because I'm thinking back to something one of my surgeons who I look up to once said in a presentation. American surgeon, funny enough, he turned around and he said, "Surgery is a controlled trauma. It's what it is. It's a car accident, man.
Totally.
Just under controlled circumstances." So, with that in mind, people always use pain as the indicator as to whether they are better or not better, and that's not right. Okay, because pain can
Mhm.
mask a whole host of things. So, I always say to my patients or my clients, right, if you're going in for surgery, we need to be really conservative in that first phase, whatever that phase is. Maybe we say the first phase is 3 weeks and then we'll reestablish what our next phase is after that. In certain instances, okay, I know the personality and character of the individual who's going in for surgery. I may say to them, hey, you know what? We're going to be conservative for 6 weeks because I've got to give them a number. They need to somehow, determine, but I don't give them
Mhm.
expectations. I don't say, in 3 weeks, you will be here. I got no idea.
Right.
No idea, right? What I say is, in 3 weeks, let's relook at everything. Let's reestablish where you are. Let's get to understand what you're doing. Now you've managed to get through A, B, and C without any pain, just like you did, Paul. So now you can put on
Mhm.
D, E, and F, and we work it from there. Anyway,
Yeah, one of the things that I did really appreciate is my surgeon from the beginning was kind of like, he told me right off the bat, he's like, you are not a normal person. So your results might not be normal. But he said, I guess, at least for me, he said, if you hit these benchmarks, you can progress further. So it was like, here's the timeline, but here are also the benchmarks that we're looking for. And once we get to these benchmarks, these are the next steps we're going to take.
Exactly.
And I also understand, like, for me, especially, like, I work in physical training and I have the kinesiology background. And so I have this library of information available to me, along with providers like yourself and, Danny Lamartina and Matt Nickel and my therapist, Ryan Morrison, who's been fantastic. So I had enough information to know, like, I'm in the right hands, and I also trust myself. Um, One of the challenges I'm dealing with right now is that my physical capacity, I know for a fact, drastically exceeds the tolerance of my tissues. And what I mean by that is, I could squat 800 pounds before my surgery. So if you ask me to do a quarter squat against pins, for example, like limited range of motion squatting, in order for me to get any sort of stimulus from that, we're talking loading 2, 3, 400 pounds to actually get my muscle to work. But my tissue can't tolerate that. So that's why we've kind of had to be a little bit more creative in how we create a stimulus. I know that's probably not the norm. I feel like you see the opposite, where the tissue is kind of healing, but the person's capacity for movement is likely behind. Would I be wrong in that assumption?
Not at all. Again, I'll get patients from both silos, shall we say, right?
Mm,
So, but the majority of people are not at the same athletic capabilities as you are, right? So
mm.
with that component, we have to, that tissue needs to heal, right? And then we've got to start building up those physical capacities once again, because the spinal surgery just adds more trauma. And prior to their surgeries, right, they were, or prior to that surgical procedure, they were quite limited anyway. So their physical capacity had deteriorated significantly, right?
Oh, that makes total sense, right? So I'm coming from a situation from myself where I was highly functional prior to surgery, and then all of a sudden, boom, gone. Whereas most of the patients that you're seeing are having this declining physical capacity
Correct,
leading
correct.
into their surgery.
Yeah,
That
because
makes total sense.
I don't deal with traumatic spinal injuries. So our A&E
Mm,
department or ER departments deal with that. That's not my gig. So as an example, this was a case that was very emotionally trying on me, and I don't have consent from the individual, so I'm going to try and mask the
of
case a little
course,
bit. But this
for sure.
particular individual, a young man, clever young man, shall we say, didn't quite uh, garner his academic results as he had hoped for, and unfortunately decided to take matters into his own hands, and decided just to plop off the top of a building. And so that
Oh my
was
goodness.
survived, but that was a traumatic injury to the spine, and he was rushed, and my spine surgeon did the surgery. So I don't,
Mm,
and prior to his to him falling, he was really, quite physically well and fit, but my whole point in saying that is I don't deal with that initial rehabilitation stage, right? So
right.
once he had recovered from the surgery and everything had recovered, that's when I took over, and I managed to get him back to full functioning capacity and capabilities. Whereas in your case, as you so mentioned, right, you've gone from an extremely high level of performance to a sudden trauma.
Right.
So, as I say, I deal with both, but not to the same degree as what you've
Mm.
had to deal with. Because with spines, it's a bit different to knees, and
Oh, Yeah, without question.
Yeah, there's just so many different components as to how you regress from a functional capacity over time to what puts you then into a surgical situation.
So let's kind of dovetail off of, this past individual, and let's talk a little bit about the state of mind of the, we'll call it client or patient, who undergoes an injury and subsequent surgery. I'd love to hear your take on how the mind influences the body within the rehab process.
Paul, I can't speak for any of my patients, and I'll tell you what I'm going to do if you don't mind. I'm going to tell you
Yeah,
what
please.
I'll tell you what I went through.
Okay.
Um, I always knew that I was inevitably going to land up for the surgery for my surgery, which was a fusion. And so over the maybe the 3 or 4 months prior to me actually going in for the surgery, I was already psyching myself up, right? Because I come from a martial arts background. So anything that I face is a war, right? And I have to come out victorious. That's just how my head works, right? For me, if you come second, you're the first loser. That's just how I grew up. Yeah, that's how I grew up. I don't believe in that. Anyway, I have to tell you, there were nights when I was at home preparing for the surgery, and I'm not ashamed to say this, but I was crapping myself. I really was, because as a spinal clinician, I had been in surgeries with my surgeon and watched fusions, right? So I don't know whether that was a good thing or a bad thing, but all I know is that I had that image printed into my mind. And I would
Hmm.
lie there at night, and literally I could feel myself, I could feel the adrenaline, I could feel the sweat, I could taste the nervousness in my mouth. Okay. And I think
Yep.
only warriors will really understand what I'm talking about. And Paul, it was quite interesting because I got to the point of where I just decided, that's it. I'm ready for the surgery. Let's go for it. Okay, I'm in. Because if I think about it too much, I'm going to make crazy decisions. I've made my
Hmm.
decision. I'm in. Plus, it got to the point of where it wasn't very elective anymore. So I was starting to lose function in my leg. Anyway, obviously, what I hadn't considered was the fact that my second surgery was going to go horribly, not wrong, but be a way more traumatic than I had planned for, leading to 5 further surgeries. So, what was interesting is the first 5 surgeries all occurred within about 2.5 to 3 weeks of each other. So, from
Ooh, okay.
middle of June of 2020 to the middle of July 2020, so within those 2.5, 3 weeks, I had the first 5 surgeries. By the 5th surgery, Paul, I had lost all use of my left leg, gone completely. Now that didn't I didn't have that prior to my surgeries. And I lay in that bed, right? I was supposed to be in hospital for 2 nights. I was there for 3 weeks. Can I tell you the thing
Mm.
I remember the most? And I remember everything, like every single
Yeah.
detail is etched into my brain. But the thing I remember the most of being in hospital for 3 weeks is that last week was disastrous, because at that stage, the nurses knew that they couldn't do anything for me, right? I knew that
Hmm.
the nurses couldn't do anything for me. They couldn't give me any more drugs than they were giving me. They couldn't do anything to dampen the pain. So when I was in pain, I'd hit the nurse call button, and usually they respond what, within 30 seconds, a minute, maybe if
Yeah.
they're really busy, 2 minutes. 20 minutes later, still pushing that button. Okay, 25 minutes later, because it was a combination that I found out later on, that they were too traumatized to come into my room, but also they knew that they just couldn't help me. Their hands were tied. And that last week, because it was during COVID, so even my family couldn't come and visit me at that stage. If I
Oh my goodness.
the mind, Paul, started to go mad. And there were two things in my mind that kept me sane enough to be able to get discharged from hospital and not go into a mental institution because I was going mad. Two things. The first one kept a little bit of humor going, right? And I'd repeat to myself in my head every single night. I'd say, you can't, it's not so easy to kill a South African. Okay. So I would say that.
Okay.
And I'd repeat that in my head the whole time. It's not so easy to kill a South African. And the second thing, and I kid you not, is that I thought to myself, if I die, because I literally thought I was going to die. I said, if I die now, I said, I will be highly disappointed because there are still people in this world I really want to piss off with my existence. Right? So that literally, Paul, right? Those two things are what kept me going, right? Is the fact that I thought you can't kill a South African so easily. And secondly, is that there would be too many happy people knowing I'm dead. And I couldn't come to terms with that, right? So as to whether that was true or not, I don't know. Okay. But it worked for me. It totally and utterly worked for me. But also, I've never, ever, ever known to give up. I just don't understand what giving up is. For me, giving up is I'm done. And I couldn't care how bad the pain was, is that it just wasn't going to keep me down. And I knew that I was going to have a seriously hard few months, possibly even few years ahead of me. As long as I could get around my head that I wasn't permanently damaged, I was good, right? And so
Mm,
from that perspective, those are the two things that kept me going. And Paul, let me tell you, I can tell you stories. I know for a fact, because I'm part of that hospital now, there were nursing staff who actually left the hospital because of my case, because mentally they couldn't come to terms, because they're a musculoskeletal, they're an orthopedic hospital. They're not an end of term hospice, right? They've
right.
never, ever had anyone go in for a surgery and stay there for 3 weeks. Not once. I was the only patient ever. And on that basis, they didn't know how to deal with all of this, right? So
Right.
I had to, at 3 o'clock in the morning, right, when there was no one there, and I was literally biting on my pillow because the pain was unrelenting, all right? It literally. And I was literally, they give you those plastic pillows in hospital, right? So that
Yeah.
so that they don't absorb germs. It was in my mouth, Paul. Okay. And I had to come up with something in my brain that allowed me, okay, to have the ability to pull through, to get on my feet and conquer this battle in front of me. And those were the two things.
I think it's incredible that not wanting to die before you piss more people off was one of your motivators. I fucking love that. I
That
love
was it,
that.
man.
Um, and like for me, the thing that I remember most about the hospital that was the most challenging was the loss of autonomy.
Mm.
Like the complete loss of autonomy. I've never experienced anything like that before. Like not being able to wipe my own ass. Like that was, I was like, okay, what the hell am I in for the next little bit? Um, and luckily for me, I only had a period of maybe 16 hours of really bad pain when the nerve block wore off. And that was my first experience of like gripping the handles on the hospital bed, crying, shaking, sweating, like couldn't get over it. And they couldn't get my doctor on the phone to increase my medication. So they couldn't give me any more. That was really, really bad. But I think knowing for me, it was knowing like, I'm going to get through this. Like I knew I was going to get through it. And what I leaned on and what I shared with my audience over social media was that if I identify in my day-to-day life, even before this surgery, as someone who does hard things, well, this is just part of that. And it's another way for me to kind of galvanize my identity as someone who does hard things. And, knock on wood, I know now that most likely I'll never have to deal with something that hard ever again. And if I do, I'll at least have the perspective to overcome that as well. But now when I look at problems in my daily life, I can look back and say, well, I got through this. I can get through this. Like nothing is ever going to compare, no work related stress is ever going to compare to gripping the sides of a bed, crying, shaking, and sweating. So it almost like calmed me to some degree. And then
Awesome.
understanding that every single day, and I mentioned this when we were emailing back and forth, like every single day I was forced with like getting all of my emotional triggers pushed. Like that was really hard for me. Like I have a big aversion to being a burden on others. Well, surprise, you're a burden on everyone else. You
Yeah.
have no choice to be, you're in it, buddy. Um, Not being able to potentially live up to the service quality that I wanted to with my clients, not being able to deliver the way that I know that I can, all these feelings of inadequacy. Well, yeah, because right now you're inadequate. And it's that first part of the sentence, right now. This
Correct.
isn't permanent.
Correct.
Um, and I think because I had this high level of acceptance, I think that sped up my recovery. I think just accepting where I was at that point in time made my recovery easier. I'm wondering for you, do you see the inverse in some of your clients where they kind of fight their situation? They're like, I'm not disabled, or, I'm not this type of person and this isn't happening to me. And that arousal stress kind of just compounds on itself and prevents them from healing.
Absolutely. And, it's a very good point, Paul, because unfortunately, there's many patients that I get to see from a structural perspective. They don't really have anything that's significant, right? Now, I'm not. That's not a dismissal of their pain. That's saying
Right.
on a medical scale of something that we determine, is it a mild, a moderate, or a severe uh, abnormality? A lot of people that I will get to see will have a relatively mild structural abnormality. They have made their pain significantly worse by obsessing about it, and not obsessing about uh, the recovery process and just accepting, hey, this is what it is. I'm going to do my best to resolve the situation. But
Mm-hmm.
I've seen this a lot, Paul, and it's no fault of theirs. There's two things that stick out for me. Number one, they've never been given a proper diagnosis, right? So either they've been
Okay.
told that, oof, their radiology is absolutely normal. There's nothing wrong with them, and the pain's in their head. Horrible statement. Horrible.
Horrible.
Okay, it's terrible. The pain's not in their head; it's in their back, right? So what happens then? They start to think that they are absolutely mad. Okay, so that's the
Mm-hmm.
first thing, and the second thing, okay, which is, I don't know whether it's a good thing or a bad thing, Paul. I still haven't got my head around it, but in the context of my patients, it hasn't been good. They get onto internet forums, Facebook forums about back pain, leg pain, sciatic forum, this forum, and they hear every sob story and disaster story in the world. And what happens is, right, as we know, as again, as the saying goes, protect your thoughts, because your thoughts, right, become your words become your actions become you. And when you are constantly reading about all of these sob stories and bad surgeries, and this injection didn't work, and I've got this thing, and I'm self diagnosing myself here, that becomes your reality, right? And I'll never forget this, Paul. I'll never, ever, ever forget this. My fifth surgery, my surgeon comes into the room and he says to me, now I trust my surgeon now with my life. him and I are like this,
Hmm.
bound at the spines forever. He came to
Yeah.
my room and he said, Joel, listen. He said, we're potentially going to do a sixth surgery. He said, I'm going to present your case at my medical meeting tomorrow. And he said, I'll let you know. And I said to him, I said, bud, do me a favor. I said, I want to join the medical meeting because it's in the hospital.
Okay.
I'll join on Zoom or whatever else in my room. I said, because it's my spine. I'm a biomechanist. I said, I want to join. He said, no chance. He said, this is between me and my surgical colleagues. He said, you're the patient. Sit there. Anyway, Paul, at that stage, I phoned my partner and I
Hmm.
said to my partner, I said, listen, this is what's potentially going to happen. Because remember, they couldn't visit me in hospital, right? So I said, this is what's
Right.
going to happen. And I said, I want to join because this is what's going on and that's what's going on. And therefore, I want this and that. And she said to me, Joel, literally, she said, shut your mouth. She said, you are not a spinal biomechanist. She goes, you are a patient. She said, let the medical professionals do what they've got to do. She goes, sit there and stop thinking you know the answers. And I was like,
Oof.
fair enough, fair enough. And you know, Paul, I have to tell you, had she not said that to me, I think I would have made myself worse. And I actually put the phone down. I thought, that's right. Actually, I'm the patient, right? Because what I
Mhm.
say to my patients is stop reading Dr. Google. Stop trying to diagnose yourself, right? It makes it what it does. You then create that reality of you think you know what's going on, but you actually don't. Now, again, it's not their fault, Paul, because they haven't had a proper diagnosis. But when they get a proper
Right.
diagnosis, even if I don't have the resolution for them, they say to me, you cannot believe the weight off my shoulders. I get it, right? Because people want a route, people want a path, people want to know where to walk, Paul. They want guidance, man,
Hmm.
right? So you knew that what you had in hospital wasn't going to disable
Right.
you for life, right? You knew that it was a moment in time. And this moment in time required you to man up more than you've ever in your entire life. And that actually meant to allow other people to do stuff for you. That was you manning up, and you did it.
Hmm.
Look at where you are now, man. That's awesome.
Yeah. I think the the quote that was in the back of my mind was, and I say this to my clients all the time, is you say you'll do anything possible to get to where you want to be. What if anything possible was nothing? What if doing nothing would get you to where you want to be? And I just kept that in the back of my mind the whole time. And it's really allowed me to the word acceptance has been front of mind for me, and just accepting circumstance and maintaining objectivity. So you mentioned looking at forums and Dr. Google and all that stuff. I have a number of friends and colleagues who have had similar injuries to mine. So the first thing that I did in the hospital was reach out to those people. One of which, was a former mentee of mine, very close friend. He reached out to me and he was like, "It's going to be okay. I'm 6 weeks ahead of you. This is what you can kind of expect." And his injuries were way worse than mine. He sliced his patellar tendon in half, tore his retinaculum, ACL, MCL, like real bad. He's still hobbling around, and he's 6 weeks ahead of me. So he's 17 weeks now. But he was like, "You're gonna be fine. Here's what I did that sped up my recovery. Here's the things that you don't want to do." I reached out to a couple of other people, and they said the same thing. This is what you would want to do. This is what you don't want to do. And I took one thing that I did do is I took everything with a grain of salt and weighed everything against one another. And then I also weighed the information that I was getting from my own providers. And I think one of the best things that I actually did was I got my care transferred from the surgeon where we were located to the surgeon who did my knee surgery in 2015. So he took over my care when we got home. and his clinic had some amazing people. The physical therapist that I'm working with now is actually he was working with the Toronto Maple Leafs, so he's got
Gotcha.
a great repertoire of experience. And so I have this massive library of information that I can look at with objectivity because I've disconnected that emotional piece.
Correct.
That acceptance for me disconnected the emotion. And even though, like I said this in my YouTube video, I'm like, this super sucks. Like it could not, like other than losing my legs, this could not suck more.
Yeah.
But it's the reality.
Correct.
And I think even for me, when I'm dealing with clients who are going through, usually I just get like the mechanical back pain or like SI tweaks, things like
Yeah.
that. I have a client right now comes to mind. He's been dealing with something pretty chronic for the last month, and it hasn't made progress. And he messaged me. He's like, "I'm going crazy." I'm like, "How about we take a week off of training?"
Yeah.
And he was like, "Oh, I don't know. I think I'm going to go crazy." I'm like, "No, you're going to rest for a week, and then we're going to see how you feel." So we've been doing weekly calls. He took a week off. He's like, "I'm starting to feel a little bit better." I'm like, "Cool. Let's take another week off."
Exactly, man.
He's starting to feel a little bit better. I'm like, "Okay. Are you in pain day to day when you're doing activities?" Not anymore. Great. Let's start to include a few different daily activities. And then you start to layer things on top of each other nice and slow. You don't try to jump back into doing exactly what you were doing before. And I think that's what a lot of people miss. I'm thinking I'd like to dive in with the last the last 20 minutes of our talk here into maybe some actionable things that we can pass on to coaches that we've seen great results with in terms of, let's say that, because you're not dealing with acute recovery, you're dealing with kind of return to function.
Yeah.
Let's talk about that return to function, considerations for exercise selection, range of motion, that sort of thing.
Got you.
Broadly speaking.
Got you. Paul, can I ask you a quick favor just off the podcast? I need to just quickly run to the loo. I've drunk way too much water and coffee.
For sure, man. Yeah.
You want to talk about actionable things for coaches and their clients. So again, just from my experience and who I work with, Paul, and I don't know whether I said this on the previous podcast, but I'm going to say it now, is that a spine surgery patient is
Mm-hmm.
very different to a back pained patient. They are not the same thing, right?
Okay.
So once you've had spine surgery, your spine is different. It's changed, right? They've either pulled out bone, they've pulled out disc, they've pulled out both. Um, so you need to respect your new anatomy. So whether I'm dealing with a back pain patient or a spine surgery patient, the very first thing I need to do as a coach is I need to determine what their capacity is and what their spine's tolerance to forces, loads, and movements are, right? If I
Mm-hmm.
can get to understand that, that gives me the basis on understanding what exercise to prescribe and how to articulate that particular exercise for them. So that I'm not just a prescription guy. I don't just come to see me. I'm going to write you this program. It's the program I need, okay, to understand why I'm actually going to give them a particular exercise. Again, there's a misconception that people think if they come see me, they're going to get core stability exercises. I'm like, oh my God, no. That's bizarre. Like, why would
McGill Big Three. See you later.
everyone thinks they think I give out the McGill Big Three to everyone. You're insane, crazy. Not at all, right? For me, I need to understand and justify why I'm giving that exercise. So I need to know what their capacity is. I need to know what their movement proficiency is. Some guys have no idea how to move, right? It actually reminds me of a consult that I did this week of a gentleman who came to see me. He's got very, very mild back pain. And he came to see me because he's worried that in the future his back pain is going to get worse. And I said to him, and I get to see patients like this now. And I said to him, I said, first and foremost, not me, not Stu McGill, not a spine surgeon, could ever predict what the future holds for your spine. Impossible.
Right.
So I would never put myself right in a position to predict that for you. So the key is let me assess you now. Let me get a diagnosis as to what I believe is going on as objectively as possible. And then I'll tell you what the best action is. So anyway, I do my testing. I ask him to do a couple of movements just so I could observe his movement proficiency. And the guy doesn't know how to control his body. That's not an insult. That's an observation and
Of course.
justify that statement, right? But he's not an athlete. He's never been an athlete. You put this guy under a bar, the bar will crush him. So I said to him, I said, what do you like doing? And he said, Joel, I like going on long walks and hiking. I said, brilliant. I said, this is what I'm going to give you. I said, when you sit, I want you to stand up because he's got a desk-based job. I want you to stand up every 20 minutes. And I said, let me explain why. And I was able to give him the scientific reasoning as to why he needs to stand up every 20 minutes and unload his spine. I said, if you
Hmm.
want to do repetitive work in the garden, just change this little thing, a very actionable thing. So I said, instead of hanging there for an hour, doing your flower beds, I said, hey, do it for 15 minutes, stand up, do one or two little things, go back down, right? And then I said, hike and walk as much as you want. I said, you never have to put your foot in a gym because he was under the perception that he needed to get strong to alleviate the potential future back problems. There's absolutely no evidence to that at all. And I can tell
Right.
you, if you leave this guy in a gym, right, he'll be disabled quicker than he will be abled, right? Because that's not his environment. It's not how his mind works. So, to your coaches who are watching this, understand your patients, understand your clients. I know you don't deal with patients. Understand what makes them tick. What don't feed them what you want to feed them. Feed them what's right for them. And if you can understand and you've got the ability, right, to understand people, prescribing exercises is a walk in the park. It's the easiest thing in the world.
There's so much that like this is one of the reasons why I love speaking with you is because we resonate so deeply on the fact that that coach client or coach patient relationship is the foundation for everything that you do. And you started off by, we need to determine their capacity. And then you finished off the conversation where most people would think, well, if someone's worried about their back being unstable, they need to train it to become stable. And the reality is, if you learn how to move properly, your function will create the stability around your structure.
Fun,
So
man.
if you learn how to function, you're totally fine. So the postural changes that you prescribed kind of solve that problem for him. The other thing that you mentioned is you said it right at the beginning. You said, I'll program exercises and then I'll cue them the way I want them cued for that individual. And I think that gets missed a lot of the time. Just in a simple, I just got a brand new client. He's actually dealing with a slap tear in his shoulder. And I asked him, I said, okay, how are you doing with pull downs? And he said, well, I have trouble going full overhead. And I said, cool. Well, what if we just change the angle of your hand? Now, can you go a little bit higher? He said, oh, yeah. I'm like, interesting. So, can you see now how the range of motion of your hand impacts the rotation at your shoulder and all this other stuff? And he started to understand that maybe his slap tear was as a result of poor function. And if we teach him how to function through different executions of movements, we can access a little bit more of that range of motion so that slap tear isn't as limiting. And this is something that requires a ton of discussion and a ton of understanding because this person's identity is attached to their ability to function.
Of course.
So when we take away that, it's almost like injury challenges your identity to a large degree. And we chatted about it, I believe, on our first podcast, where we talked about how people identify with their diagnosis or identify with their function, and that being a limiting factor to exercise prescription. Probably one of the most actionable things that I like to do with my rehab patients or my prehab patients, or usually acute care, is okay, let's assess range of motion, let's assess pain-free range of motion, and let's try to get as much function out of that range of motion as we can. So,
Correct.
perfect example for me, uh, I can ride a bike. Cool. I can't ride a bike at high resistance because that still bothers me. So, what can I do? Well, guess what? I'm doing blood flow restricted biking because it allows me to accumulate more metabolites. It makes the exercise harder with lower loads. Well, look at that. 2 weeks of doing blood flow restricted biking, I can increase the resistance on the bike. Had I just biked with no resistance, it probably would have taken me a lot longer to accumulate the function. You spoke earlier about surgery being a controlled trauma. Well, it is a controlled trauma because that trauma is specific to the adaptation that you're trying to get from the body. So if we look at exercise in that same vein of, okay, I need to create a specific stress to create a specific outcome. What is the stress I need to induce on the body? You took it a step further and you said, I need to induce this stress on the body that fits within the makeup of this individual.
Absolutely.
And I loved it. Um, are you seeing, like, do you have anything to add to that?
Paul, I've got a lot to add to that. But, the thing
Yeah,
is,
good.
I got a lot to add to that. But, I think as a coach, and I'm not speaking now as a spine guy, I'm going to speak as my academic background, which is a strength and conditioning guy.
Mm-hmm.
You always have to have the ability to recognize patterns. You've got to understand that individual. You've got to understand how they respond. What words do you use? Probably the best university I've ever had is just seeing the amount of patients I see, because every single one teaches me to act differently, right? I always say I'm a little bit of a chameleon, right? I adapt to the patient who's sitting in front of me. So I recall something that happened to me, many years ago. It was a Sunday, and I saw two patients on that day because I was just having to fill up my week. And the first patient whom I saw was a very, very well-to-do, middle-aged female. Came from an extremely wealthy background. When she arrived at my gym, she was, carrying a handbag that was probably, $3,000, and the rest of it.
Oh my
And,
goodness.
yeah, yeah, and but a very nice individual. But I needed to use words, and I needed to be quite soft in my approach to her, because if there was any type of aggression or, Neanderthal type Joel coming out, it wasn't going to work, right? Because I need
Right.
her to buy in so that I can get compliance from her. So again, the way I was talking, and as we finished our session, Paul, we went upstairs, and as we went upstairs, my whole gym upstairs, on ground level is glass, and the front door was also glass. And as we walked upstairs, she went, "Whoo!" She was a little bit shocked, and I turned around, and there's this face, okay, that's plastered onto the glass from outside, tattoos all over the head and everything to that degree, and jewelry, and it was my next client. And this guy came from a completely different background, and you could see she was visually quite disturbed, because this is not her crowd.
Right.
And anyway, so I managed to get her out. And as I opened the door, the guy turned around to me. Excuse me saying this, but it's the only way I can say it, right? And he,
For sure.
and as I opened the door, she's standing right next to me, and he turned around and he goes, "Are you Joel Proskewitz?" I said, "I am." He goes, "Am I fucking glad to see you?" Okay. And and you could see she was, oh, she's got to get out of here. And all of a sudden, for the next 3 hours, man, I had to be Joel Proskewitz from the wrong side of the tracks in South Africa, because that's the only way that that guy, okay, would be
Right.
able to deal with me, Paul. So
Hmm.
get the exercises. Your coaches, man, you can go on a gazillion courses and they can tell you this is how you teach a squat. That great, fantastic. There's only so many ways and so many courses to learn how to damn squat. Okay. If you can't
Right.
coach a squat now, you'll never be able to coach a squat. You got to learn people, right? So I'll give you a thought process here to all your coaches as well. Vince Lombardi. I'm sure all your coaches know who Vince Lombardi was. He was
They
interviewed.
damn well should.
They should. He was interviewed once after the Green Bay Packers had won the Super Bowl. And this young journalist came up to him and said, Mr. Lombardi, we got to understand your secrets and how come, right, you know football so well. And he turned around and he said, young man, it's not that I know football well, it's that I know men. And that, as a coach, is what we have to do. We've got to know the person in front of us. And if we can adapt and we have the tools, right, to be able to understand how they learn and how they succeed, squats, deadlifts, bench press, all that stuff, that becomes secondary, man. That's easy stuff, not hard. Anyway, I could speak.
That's so that Joel, that's so counter to the narrative that is permeated these days in terms of like optimal exercise prescription and exercise execution and nuance, nuance, nuance. Yet no one knows how to communicate. No one knows how to form a relationship. Um, I was listening to a podcast actually by Mo Gadot, who's a former. He used to work at Google in the AI space, and he was saying, you know, AI isn't going to take the job of people who form relationships. It's going to take the job of people who don't know how to use AI. And he listed number one most important skill to have in the next 5 years as in intimate one-on-one relationships with integrity. And
100%.
I thought that was, for someone who's dealing in AI, I thought that was just a phenomenal insight, because you hit the nail on the head. And I think it's an asset that most coaches lack. Like when I was coming up, I did 5 years as a collegiate strength coach. So that's 500 athletes, 3 times a week, 5 years. It's a lot of people. Then I went into disability rehab, where I had a caseload of 50 to 75 people for 6 years. Plus, I was still coaching. So another 50 to 60 people for 6 years. And add into that all the coaches that I mentored and all these other things. Like I've dealt with a lot of people. And I think that is the biggest asset to me in my ability to drive these outcomes, is that I do understand people and I value the person over the prescription.
Absolutely. Paul, that, my friend, is gold, right? If you don't know people, I don't care how much you know about a squat, right? Whenever I employ people or new trainers for Performance RX, right, which is my facility here in the UK, I don't
Mhm.
care what courses you've been on. I'll sort that out. And you know why? Because that may work, it may not. I don't care, because I'm going to teach you how to teach a squat anyway, okay, in relation to
Right.
our clientele. I want to know, what is your life experience, man? Right? What have you done? What failures, right, have you achieved in your life, and how have you come back from those failures? Who are you as a person? Are you hungry? Are you obsessed about being, someone that can elevate a person's physical life, right? Not just by telling me how many squat courses you've been on. I couldn't care. So again, but Paul, you and I have been in this industry for a long time, man. I'm celebrating now.
Mhm.
October this year will be 30 years of me being a strength and conditioning coach, right?
Amazing.
Man, my trainers will vouch for me, and this is not a word of a lie. Before I went into spine full time, right? One-on-one sessions, I was doing anywhere between 55 to 60 on the floor contact hours a week. And I did that, man, for 18, 19 years, right? Longer. So when people say, have you done 10,000 hours of training? I'm like, what? what are you talking about? I've dealt with CEOs that run companies that have got 7,000 people. I've dealt with people that literally needed to save up, right, for a year to come and have 3 sessions with me. You don't deal with them the same. They're different
No.
people, and you learn. And they couldn't care how many squat courses you've been on. They want to know, do you understand me? And if you understand
Hmm.
me, can you bring out the best of me? Right? And if you can do that, man, because Paul, that's what you did. You brought out the best of yourself when you were lying in hospital. And that's what I had to do. Okay. I had to dig deep,
Hmm.
man. And I had to bring out the best of myself. And that gave me the image of, I'm going to carry on living to piss off some more people, right? Because I needed to bring out the best, man, because that's what we do, you know. So
that that quote's going to be like plastered in my head. I have to keep going because I have more people to piss off.
yeah, man, I just have
That's
to.
friggin' perfect.
So
That's perfect. Joel, man, I can't thank you enough for sharing your insights and your reflections today. Um, I love any talking with any coach who places the relationship with the client above anything else. To me, is like we need more conversations like this so that people continue to talk about it as we continue to trend into this automations,
yeah,
AI, this whole conversation. I'm going to tell you right now, ChatGPT could probably write a better program than 99% of these coaches. But you know what it can't do is relate to an individual and understand their emotions. And that's where we come in. And we truly are, I forget who I heard this from, but we're the window, right? We're the passageway between where someone believes they can be and where they are now. They're looking at where they want to go and they have no idea how to get there. And we're the window to show them, no, this is the path.
correct.
And you can't do that unless you're able to hold someone's hand, you know?
Paul, you've made me think about my business partner in South Africa, who was my mentor. Right. So when I got involved in strength and conditioning, man, he was the guy that took me in under his wing and guided me. And we still stay very, very good friends to this day. He now lives in Australia, and him and I opened the very first personal training gym in Johannesburg. And I'll never forget, we were probably 4 or 5 months into running this operation, and he said, Joel, come over to my house on Sunday night. Let's discuss, what the future holds. And he's about 14 years my elder, and so I was always very inspired by him. And he turned around and he said to me, and this was back in 1996, Paul. All right. He turned
Mm-hmm.
around and he said to me, he said, Joel, he said, let me tell you something about personal training. And I said, what, Mark? He said, this game is not a high tech game. It will always be a high touch game. And
Oh, I love that.
I've never forgotten that. Paul, I've never forgotten that to this day, right? When Mark said that to me, it was like, I get it, man. I just get it. All right. We are not in the game of high tech. We are in the game of high touch, man. People crave that human touch. People crave that understanding. If your coaches can get that, they've got clients for life.
I couldn't agree more. I think that's the perfect way to end it. Joel, thank you so much for joining me. Everyone, please make sure to like, share, subscribe, ring the bell for notifications, and drop Joel a follow. Check out Performance RX, and we'll have the links to where everyone can find him in the show notes. Even though he's not a big social media guy, he's definitely someone that you're going to want to listen and learn from. So thank you, Joel.
Thank you, Paul.